The province has outlined its vaccination plan ahead of the respiratory illness season. The government says flu shots will be available for vulnerable groups starting this month. The shots will be available to the general public beginning on October 30th. It is also rolling out an RSV vaccination program for people 60 and older living in long-term care and some retirement homes. And for reaction from the city, we are joined by Dr. Vanita Dubé, the Associate Medical Officer of Health for Toronto. Thank you so much for joining us, Doctor. What's your take in reaction to the province's plans for the upcoming flu season?
Well, we're pleased that we have vaccines that have been approved by Health Canada, the Moderna new COVID vaccine that has been approved, and now Ontario has stated that they will be able to provide it to everyone 6 months of age and older. And the timing for when the COVID vaccines will be available syncs with when the flu vaccine is available. And so people can get those at the same time. And we certainly know that we want to do what we can to prevent these viruses from spreading rapidly this fall. We've seen that, and we know that these vaccines will be very helpful for us this season.
We know from experience throughout the pandemic that obviously the COVID boosters, the vaccines have prevented serious illness and deaths, but several years later, I'm sure you can appreciate that a lot of people just are tired of being told to go get another jab and go get another jab. And when we're talking about the flu shots and more COVID vaccines, what's your message to those who feel that they're just they just don't feel that maybe they need the shot, and that they're kind of maybe sick of what they might say is fear mongering amongst the media of how constantly talking about these vaccines and that you should go get the jab?
Yeah, I think that I fully understand where people are coming from. We've just come out of a very challenging pandemic, but we're actually back to a very normal fall, except that we have this new virus, COVID-19, and influenza, our old friend, is still here, as well as viruses like RSV. So we know every fall it is a challenging time. We actually have two vaccines that can help us against two of our most important viruses. So the vaccines are necessary in the fall because these viruses will spread. We've seen that last year and the year before, but we also have experience from Australia, New Zealand, where they've just gone through their winter and have shown that these viruses started to spread again more, when we're indoors with more close contact. The vaccines themselves are safe, and we know that they can keep us out of hospital. And I know many people don't want to go to the ERs because it's a tough go there. And so getting these vaccines will help to prevent that serious illness. And that's what I would say for people who are really wondering, do I really need it? Well, you really don't want to get very sick from these viruses.
What's your response to those individuals who still have concerns about the risk of myocarditis as a result of the COVID-19 vaccine?
The risk of myocarditis was highest, we found, among young adults following the second dose of the vaccine. But for subsequent booster doses, we have not seen that increased risk with the COVID vaccines. And those that have gotten that a side effect, even after the second dose when it was more common, it was a mild symptom that they had. Most of the people recovered. So really, we're at this stage where the risks for COVID, the risks for flu, especially if you're at higher risk for getting very sick, maybe you have a chronic health condition, maybe it's based on your age, the vaccines definitely balance out in the benefit.
Dr. Vanita Dubé, we appreciate your time. Thanks for your perspective and joining us on CP24.
My pleasure.